Good morning, and it's over to you.
Good morning. I first would like to talk about reopening plans. We know that we have seen some successes, but it's still not time for us to let our guards down. I was told by a physician that we should move slow in order to move fast. And so we want to stay the path that we are on. We don't want to make any changes, because if we make hasty changes, then it could send us back to where we are overloaded with positivity of COVID cases in our community. So please just stay the course and continue to do the things that you have done. I applaud you for your efforts. I want to talk about reopening plans because it's going to be essential that all businesses, school districts, colleges, university, any business that has not been open, take a look at your business plan and put a strong plan in place. You are able to reach out to us as well when you have that plan established, and we would love to provide some technical assistance. We know that we have to put these plans in place for us to safely open and to continue to move toward a place of reopening. I'd like to also encourage those that may have a mental illness, that may have family members that have mental illnesses or close friends. Please be encouraged today. Please do everything that you can do to maintain your mental health. It is very important for us that our community stay strong physically, but mentally as well. Do the best that you can do. Check on those that you know. Make those phone calls, send those text messages, use that technology, and do the best you can do. A nice letter came through my mail the other day. Most people don't use the mail, most people send an email, etc. But I received a very nice card in the mail, and it really brightened my day. So those small gestures like that, where we can check on others and just make sure that they are okay. Thank you for your time today. I will pass over to Dr. Escott.
Good morning. I just want to address briefly where we are in terms of staging. Many of you saw yesterday that we dropped below 40, which places us in the yellow zone, or the stage 3 zone. But we've made the decision to stay in stage 4, and let me explain a little bit why. So the staging that we've created is designed to ensure that we do not exceed hospital capacity. And right now, our ICUs are still full. There's not extra room in the ICUs. The ICUs are still under their surge plan. We're still having to limit elective surgeries, so people with serious medical conditions that need surgeries that are not immediately life-threatening can't get those right now. So until we're in a better place in terms of ICU capacity and in terms of our personnel in the hospitals, we're going to need to stay at stage 4. This also helps to put us in a better place as we approach the month of September and school reopening. We need to be in as safe a place as possible. We need to decrease transmission of disease as much as possible so that reopening schools come September 8th has a decreased risk so that we can get our schools open and keep them open. We've got a lot of work to do, and I'm proud of Austin and Travis County and Central Texas, who've been very effective at getting a lid back on this and flattening the curve. We are in a downward direction. We continue in a downward direction, and we need that to continue into the stage 2 of risk. And with that, I will turn it over to Janet Pichette for some comments.
Hey, Janet, make sure you unmute yourself.
Good morning, everyone. I just wanted to say, while we're here to talk about coronavirus, I wanted to remind the community that we've had our first human probable case of West Nile virus. So While we want to make sure we're staying the course for coronavirus, we also need to make sure that we are diligent in doing those things to protect our family and our loved ones around our homes related to West Nile virus. We've had 5 positive mosquito pools in the Austin-Travis County area and 1 human probable case, which causes us concern. We haven't had a case. We did not have a case last year. So I just wanted to provide some simple reminders that we at Austin Public Health have, and that's to make sure you dump standing water, dump and drain any kind of standing water around your home. Make sure that the mosquitoes bite at dusk to dawn. Make sure that you're using DEET-related products to keep mosquitoes at bay, and to also wear clothing that will protect you from mosquito bites. So again, we are not only investigating coronavirus, but a large number of other conditions that are being reported, West Nile virus, cyclospora, and some other things, because it's that time of year for us to investigate those types of things. We start seeing more of those cases, but just stay safe out there.
Thank you. Now to our pool reporter, Tom Miller with KXAN.
All right, the first question is from us here at KXAN, and the question is, with COVID-19 cases continuing to fall across Central Texas, when could we see the city of Austin start to reopen amenities like pools, golf courses, playgrounds, and the green belts?
So we are continuing to meet regularly with Parks and Recreation regarding these various entities within the city of Austin and across Travis County. Again, we're not quite at a place where we want to take risk, particularly because the ICUs are still full and we have a long way to go in order to get our school children back in the classroom. As the situation improves, we'll continue to look at those various amenities, and it's likely that we will start with the lowest risk amenities, look at reopening those, and then continue on from there.
Okay, this next question is from CBS Austin. What do you think of UT's recent statement that they're going to limit stadium capacity out at DKR Memorial from 50% now down to 25%?
So I'm glad that they have moved from the 50,000, but again, when we look at the current rate of transmission in Travis County, if they plan to open to 25,000 on September 5th, and we've got that similar rate of transmission, we can expect more than 100 of those individuals to be COVID positive. And then, of course, from there it multiplies to hundreds of people and then thousands of people. We're not in a situation where we should be taking that kind of risk. And I don't anticipate that any time this fall we'll be in a position to take that kind of risk unless there's dramatic changes in the transmission of disease, in vaccine, in the ability to test people in a timely fashion prior to entry to events like that. Quite frankly, I'm concerned that we don't have solid plans in place to ensure that we can field 2 teams every Saturday. When we look at the disease transmission at UT football over the summer, about a third of those athletes have tested positive for COVID-19. And that's in a short period of time. The same thing is going to be true for transmission going forward into the fall. It's going to be true for opposing teams. It's going to be true for managers and trainers and coaching staff. And it's going to be a big challenge for us. And it's not just the activities which are the practices and the games where disease transmission is possible. It's the associated activities, because we know athletes aren't just going to see each other on the field. They're going to see each other at meals, recreation, and the rest of their normal daily routine. So it's going to be a challenge. I think right now football teams at college levels, even at other levels, need to focus on, is it practical to even have games without crowds? And if we can sort that out, then maybe we then could consider having some people in the stadium.
All right, this next question is from KVUE. As far as school reopenings go, the state says schools can't stay closed past the 8-week transition without jeopardizing funding. Will APH/the city still be giving schools recommendations regarding when to open their buildings? Will the school order change?
So we issued the initial orders. I initially issued the orders because we gathered our stakeholders. We met with our superintendents, and they asked that I do that because the schools are not ready. They have a lot of work to do. They've got to get teachers back on campus and comfortable with the risk mitigation strategies that they're working on. We've got to sort out if a substantial portion of those students are going to be virtual, how those teachers are going to be able to provide classes virtually. This is not something they normally do. And, there's quite a bit of heavy lifting that school districts have to do to make the fall semester work. Quite frankly, I don't believe the TEA commissioner is best suited to determine what's in the best interest of the public health. I think that needs to be up to local officials working with our stakeholders. I think the decision to withhold funding is contrary to what the National Academies of Sciences have recommended, and many, many others, which says that states should not do that because it pressures schools to push students into the classroom where it may not be safe. So I think the commissioner needs to rethink that. I think we have to continue to work together as local and state government to find a solution for this very challenging problem of getting students back in the classroom.
All right, next question is from Univision. A special task force was created to help Latinos in the fight against COVID-19. Hispanics continue to be the most affected. Has any progress been made by this group?
There has been some progress in that area. When the survey went out and staff reviewed that survey, 23 of those items were completed of the strategies and are ongoing strategies. What we really think will be helpful is as we continue to have meetings with various stakeholders and work to pull more groups together and hear more from other individuals, it's going to be important for us to get the feedback on the work that has been done and how we can make some additional improvements.
All right, this next question is from the Austin Chronicle. When UT Austin reopens for the fall semester, will UT students be able to access isolation spaces through Austin Public Health if they can't self-isolate or quarantine safely in their residence? And if so, where are the facilities and how many students will they be able to accommodate?
The isolation facility is open to the public. We've met with the University of Texas, and they have included the isolation facility in their plans for students that can't safely isolate that live off campus. They have put together some additional plans for the individuals that live on campus. And so our plan is to be able to work with them, but not just the University of Texas. We are working with other universities here in Austin and Travis County to ensure that we have that available for them as well.
I'm just going to add on to that. I had a great meeting with Director Hayden and St. Edward's University yesterday, who's really put together a fantastic reopening plan. They've considered all the challenges and concerns regarding reopening, both for the faculty, staff, as well as the students. And I've just been very impressed with the work their team has done. I think there's a lot of lessons that other campuses can learn from places like St. Edward's, who've been just very thoughtful about their approach to ensure that when people return to campus, they can do so safely And, for those that aren't able to do that or unwilling to do that, they can learn virtually.
All right, this next question is from the Statesman. Why do you think Austin-Travis County has seen more success in getting coronavirus cases and hospitalizations down over the last 2 weeks compared to other Texas cities? Have we implemented any unique strategies or methods?
I think the primary reason for success is the people of Austin and Travis County. I think they respond to the data and the science, which says that we were in a bad place and that we needed community action to make a change. I think they put on their masks. I think they social distance. I think they paid close attention to their personal hygiene. I think they stayed home when they didn't have to go out. Again, there's not a magic trick that's going to work for COVID-19. It takes the will of the people to control the disease. And, we're going to oscillate throughout, the next year until we get a vaccine in place. And I'm just incredibly impressed with the people of Austin and Travis County and their willingness to engage in those protective actions. We're going to have to ask you to do it again. This is going to be a reoccurring theme because this threat is not going away until we have a vaccine which is widely available. So I am grateful for the public. I'm grateful for the media for sharing these important messages. We're doing it. We need to continue to do it, and we'll have to do it again.
I agree with Dr. Escott. We really must applaud the citizens of Austin and Travis County and just thank them for their efforts. Even if the effort they felt like was a small effort, so whether great or small, all of the things that we've done and the things that we can also teach others to do. It is going to be so important about the behavior that we have and not taking those risks and ensure that we and our family members and our friends that we have influence over, that we're able to talk with them even more as we move forward. The other thing that, I applaud our citizens, but I also like to really, really applaud our elected officials and, our staff within Austin Public Health. Our staff have just worked tirelessly, 7 days a week and have really, really just really towed the line for so long. And so just applauding the Austin Public Health staff. And lastly, we have collaborations across the city where we have developed new relationships and partnerships, whether it's with individuals in the community, nonprofits, or whether it is at our hospital systems. And so those collaborations and us working together and having that communication daily has been very beneficial to us. Those are relationships that, across the state of Texas, they don't have those similar type relationships. And so I feel like as a Austin and Travis County, we have all come together to really just take the action that we all needed to take. And so I just applaud everyone.
And I would just like to add that while everybody's done a remarkable job, I think the public needs to continue to stay the course, and we need to continue to have our numbers drop lower as we prepare for any potential second wave that might occur when school starts.
All right, this next question is from Fox Austin. You said we are not rolling back to stage 3 because the ICU is full. What indicators are you looking for to be able to safely roll back, and are we close to that?
Again, we have regular communications with our healthcare executives. I think certainly we need to be out of surge condition in the ICUs, and we need to have some buffer. We need to be able to have folks be able to have elective surgeries again, and we need our rate of positivity to drop further. We want to certainly see it below 8%. We'd like to see it below 5%. Right now, when we look at other states who have state measures or thresholds or goals for active cases, those goals, like the state of California, are 25 active cases per 100,000. Yesterday, we were at 186 per 100,000. So we've got a long way to go before we're going to be more comfortable. I'm hopeful that we'll continue this course in the next couple of weeks. We'll be in a different situation.
All right, this next question is from Community Impact News. Although new hospitalizations and cases have been down over the past week compared to earlier in the month, the pandemic is still present. What future actions, if any, do you see local health officials taking to assure the downward trend continues?
I think the actions that you've seen are actions that we would repeat because they've worked. Again, we are extremely limited by preemptions from the state on what we can order, but we're not limited on what we can influence. And again, it really takes those collaborative efforts, as Director Hayden mentioned. It takes the will of the community, the will of the people, to act in a protective way. I think early on in this pandemic, a lot of faith was placed in contact tracing as the solution. And this team has been saying for a couple of months now, at least, that it's not the solution for this. We can't contact trace this away. Certainly not when we're getting 500 or 700 cases a day. But even then, even when cases are lower, it's challenging because we have a substantial percentage of cases which are asymptomatic. We have a substantial percentage of cases which are mildly symptomatic. This is not like Ebola or other diseases where there's a distinct clinical course and a severe outcome. And because of that, we also have challenges with people wanting to engage in that contact tracing because it means they can't go to work. It means they are restricted. But I think success is going to depend on the people, depend on that collaboration, and depend on the community willingness to engage in those protective actions.
This next question is from KOOP Radio. This pandemic has proven that preempting problems arising in response to community transmission saves lives. What is APH's plan to quickly and completely distribute an inevitable vaccine to the communities most affected by community spread?
So currently, we do have a vaccine distribution plan that we developed during the 2009 H1N1 flu season and the response to that when we had a large number of vaccine to distribute. If you remember back then, that was a time when commercial pharmacies did not actually provide vaccine, but now they do provide vaccine to the community. So we hope that we'll be making sure that we engage in a number of providers of vaccine to make sure we have a system in place so that they can receive, store, and distribute vaccine to the community. We also have plans for drive-through. It's kind of like our point of testing site. However, it would be a drive-through vaccination clinic, which we've tested throughout various flu seasons, and that is an approach to quickly deliver vaccine to the community. People literally drive their car through, they stick their arm out, they get vaccinated, and they drive off. As well as, making sure that our providers and other, we'll be holding, I'm sure, some clinical practices or clinics as well to distribute that medication. Although the challenge with mass clinics is bringing people into a central location and having them exposed in that setting. So that's what makes the drive-through model, a good model for vaccine delivery.
I think the other thing that is really going to be important is that we know that everyone doesn't have access to transportation. So we have to be very, really strategic in providing services in communities that have tested positive for COVID-19, but also have health disparities. So our plan would be very flexible as we work to be able to do things as safely as we can, but ensure that we are meeting people where they are. That is going to be very important. And we will collaborate with our other partners as well. We have several partners that we work with throughout the community, just when we're doing just regular vaccines in the Vaccines for Children program. And so we are really excited about that opportunity, and will ensure that we get it to the individuals that need it the most.
Okay, this next question is from KUT. Are you seeing disproportionate hospitalization rates among Latinos?
Yes, we have noticed those disproportionate rates between Latinos early on. Early on, we worked very closely with the hospital systems in order to receive that data and make sure that that data was posted on our website. Early on, we established a social services branch and established a priority population group. That priority population group has worked across the city with community partners to ensure that most of those responses and strategies that are in that Latinx plan were developed early on, and staff have been able to provide those services early on. We continue to work in that space because ultimately our goal is to get the education out there, provide the supportive services, ensure that we can bring those numbers down by working collaboratively across our community.
I want to also add that it's not just our Latinx community that's overrepresented in terms of hospitalizations. It's our African American community as well. Between the two, it's more than 60% of the hospitalizations, and they only represent about 40 to 50% of our population in Travis County. So again, we've got ongoing evidence that this disease is disproportionately impacting our communities of color. And this is why we all must come together to ensure that we are providing protections for these communities, and at the same time addressing the underlying disparities that have plagued these two communities in a systematic way for decades. And we've got a lot of work to do.
Okay, circle back to the second round of questioning. So this question is from KXAN, and it is sort of follow up on what you were just saying. Where has the most progress been made, and in which communities are you seeing that progress?
I would say that, we are really seeing progress really across the community. Our efforts have been, more mass media initially, but as we continue to look at the data, we have deployed more targeted interventions. And so we are really going to emphasize the importance of getting those tests. We have been able to work with the Texas Department of Emergency Management. We've stood up a testing site in Pflugerville that's open 5 days a week. We will have a testing site at Dow Valley, which will be able to provide those tests 5 days a week. And we've also, starting this Saturday, we have 3 testing locations that will be open on Saturday, one in Rumberg at Walnut Creek, one at Givens Park, and then the other one at Dove Springs Library. And so it's going to be important for individuals that have been exposed to an individual or has symptoms to go ahead. Those are walk-in clinics. They will, assist you once you get there. If you want to go online and schedule it that way, you can, or you can call our nursing hotline. But we really want to still emphasize that we do want individuals to go into these testing sites and to receive their testing.
All right, I believe you already addressed this next question from CBS Austin. So I'm going to ask the next question from Univision, which is, When deciding whether or not to send children back to school, many Hispanic parents who lack the economic funds to keep their kids at home will have to make the tough decision to send them to school. What options will city officials be offering parents who can afford to stay home with their kids because they are the sole providers?
We have we work very closely with nonprofit agencies at the city and the county. And the city and the county both offer assistance through our neighborhood centers and community centers. And we really want individuals to reach out to those facilities and schedule an appointment and meet with the social worker. That social worker can assist them and develop an individual plan to determine where they can plug them into any type of assistance that they need. But it will be an individual decision, and we cannot make that decision for families. But we know that we will have and will continue to have these social services available to assist them.
Okay. We're going to go ahead and ask that question from CBS Austin, which is, now that hospital admissions are under 40 on a 7-day rolling average, what other criteria needs to be met to drop Austin to stage 3 of the risk-based guidelines?
Again, the part of the decision is based upon the ICU admissions, and once the hospitals are out of a surge situation, we're also looking at the other supporting indicators, which include the percent positive, as well as the number per 100,000 of positive cases or active cases in the community. Again, we expect that if we continue to see a decline as we have over the next couple of weeks, that we'll make the decision to go to stage 3. But ultimately, we still have to decide what our priorities are. And if our priority is, as a community, to get children back to school in a safe way, to get teachers back in classrooms in a safe way, and we've got a lot of ground to cover. And that means we need to be more protective and take less risks so that we can get to that better position.
This next question is from KVUE. Is there any update on the delays people are seeing in test results? At this point, what is the average amount of days for turnaround time?
So we have seen improvement in the turnaround times for tests. There's still variability, though, based upon which lab that test is sent to. Ours are around 3 days for the ones that are sent through Austin Public Health. There are some that are going to national lab chains that are still taking 7 to 10 days for a return. Again, as we've seen cases start to decline in Texas and locally, we've seen them start to increase in other parts of the country. And that means that more demand is coming from other locations. And this is why we've partnered with a number of labs to ensure that we have labs here in Texas that are going to be less subject to national surge to provide those results. Ultimately, we need to be able to get results within about 24 hours from the time the test is done if we want to be really proactive in managing this disease. Obviously, when we have test results that are coming back even 3 or 4 days later, the efficacy of the case investigation and contact tracing declines. And this is why we're looking at other testing strategies, including antigen testing, which may be good enough to provide us results in a more timely fashion, about 15 minutes. So we may have the potential to test people and give them a result before they leave, which would be the ultimate solution to help address the situation and decrease the risk of transmission.
Okay, the next question. Go ahead.
So I was just going to add that, we have, as we've said, we've noticed a decline in the number of cases related to PCR testing. And so last week when I said we were trying to be cautiously optimistic, we were also looking at whether or not we see an increase in the rapid antigen testing that's occurring throughout the community. And so we'll be continuing to monitor that. to make sure that we're having a decrease on all fronts.
All right, the next question is from the Austin Chronicle. What are Austin Public Health strategies for contact tracing as it works with UT Austin to conduct contact tracing for UT community members who test positive for COVID-19?
So currently we have an interlocal agreement with UT Austin, and they have a group at their university that will follow up on all UT related cases. So they not only do the contact tracing, do the initial case investigation, identification of those contacts, and then they follow up on those contacts, and then that information is then reported to us. If there are facilities or congregate settings that are identified, that information is reported to our epidemiology team. We have several different cluster teams that are working on either long-term care facilities, school clusters, or other other types of clusters that are in the community related to congregate settings, workplaces, and things like that. So we work very closely with UT regarding contact tracing, especially within their population. As one example is the UT Cabo study. We worked with them on that, working with the case investigation of providing them information for, and they actually did the case investigation and follow up on those cases.
The other thing I will add is as we have been working with UT Dale Medical School, they have put together a plan where their epidemiologist has been attending all of our meetings with our epidemiologists. And so when we have our contact tracing meetings, as well as our daily meetings, she is a part of those meetings. And so she is able to ensure that the information that they are providing and receiving through the University of Texas is submitted into our Salesforce system. And so that continuity and that working relationship that we established months ago has really been very beneficial. So as they shift and they're going to focus solely on the University of Texas, all of those lessons learned that all of us have gone through the last several months have been very helpful, and it will be beneficial as they move forward to provide those services for the University of Texas.
Okay, and from Fox Austin, do you plan on advising reopening recommendations for closed bars?
Let me just say that bars are probably the riskiest place in terms of risk of transmission of disease. I don't think there's any practical way to mitigate the risk of face-to-face spread in a bar. You can't wear masks in a bar and be drinking. You can't social distance effectively in a bar because that's not the nature of a bar. I think that the bar industry has a lot of work to do to devise a plan where they could reopen safely, which means restructuring how they do business. I simply do not believe that we're in a place now or any time in the near future that we would want to recommend bars reopening.
All right, and our last question is from KOOP Radio. Considering the COVID outbreak at USC, what is the city doing to prepare for returning UT students, faculty, staff, and football fans?
We are working closely with, as I stated earlier, with UT Dale Med, which is going to be providing assistance to UT. But it is important for us, as they are looking at what are their reopening plans, that they're able to talk with us about those reopening plans and share any concerns or questions that they may have in regards to the orders that we have, as well as what is the best way to safely to mitigate the spread of disease. In our conversations, we're very candid. We know that we are not going to say that when places start to open, we're not going to see cases. We're going to see positive cases. That is the reality. But we want to make sure that they can safely mitigate the disease, that they can safely look at what is causing the disease and be able to get those individuals into testing, get them to isolate and quarantine so they don't further spread COVID-19. So it's just important for the colleges, the universities, the schools, as everyone is looking at their reopening plans, that they put those plans together or reach out to us, because we are willing to help them in any way we can.
And let me just mention about the football fans question. Again, I love college football. I watch it every weekend. It's part of what I do in the fall. But we've got to remember that people don't just teleport into their seat at the stadium. They tailgate beforehand. They gather. They queue in order to get in the stadium, which means they gather. They go to their concession stands. They buy food. They buy drinks. They're going to be consuming those food and drinks when they're sitting, which means they're not going to be wearing masks. They're going to be yelling at the game, which means they're going to be projecting their voice and increasing the risk of spread. Yes, there are football stadiums which are outdoors, which may help mitigate that risk. But again, similar to bars, there would need to be a lot of engineering controls built to ensure that we can do that safely. And I think if we want to focus on having a football season at all, the universities need to focus on ensuring that they can field 2 teams each weekend. And if we can do that successfully, then consider how can we get fans back in the stadium.
Thank you so much. That wraps up our questions from the media. Before we wrap up, though, would you all like to give any closing remarks?
I would say we need to stay the course. We need to stay on this path that we on. Don't celebrate. And as Dr. Escott said a few weeks ago, don't go out dancing. And if you dance, dance in your house. There's great videos, great music you can turn on. You can dance at home. But I will say that the things that have got us here has been the call to action, that you all stood up and you said, yes, sign me up. I am going to be that person that's going to make a difference with COVID-19. And we need you to continue to make a difference, continue to be an influence to others as we continue to stay on this path. It has been really great for us. We made the decision to close some park amenities. We know that has helped us as well. And we've got to stay the course. We've got to think about, this is our priority. Our priority is to get to level 3, level 2. We want to be able to get our level as low as we can on our risk-based scale. The other thing I'd like to say is just emphasizing those reopening plans are going to be essential. They're going to be essential to when we start slow in order to move fast. The last thing I'd like to emphasize is about the testing. We do have our testing available. So if you are having symptoms, please go online to our platform, call our nurse line, and schedule an appointment. We have all of our sites that are going to be open on tomorrow. So please make your way and get your test done. If you are having symptoms, please stay home. And as you're waiting for your test results, please stay home. Thank you very much.
And I'll jump in next and say, as Director Hayden said, we've done a great job, but we've got more work to do. I think we have to talk about our priorities. If our priorities are getting children back into the classroom, making it a safe situation for students and teachers, we've got to get better than we are right now. If we value and want to prioritize having businesses open to a further extent, we've got to continue to do better. And then we have to weigh as a community when are we willing to take other risks? We talk about college football. Similar discussions need to be had regarding other UIL activities, football, band, other sporting events. And, you know, again, if we want to prioritize making sure that kids get educated, we need to focus on those things. And once we can do that safely, then we can think about the extracurricular items. Again, Austin, you've done a great job. You've been an example for other cities across the state, and let's show them how much better we can do.
And I would just say we need to continue to fight the fight. You know, we're doing a great job in flattening the curve. I'd like to see it get even lower than it is right now. I do want to remind the public that there are other conditions out there that pose a threat to their families, and that includes West Nile virus, to make sure you do those prevention activities to reduce mosquito bites and a resurgence of that particular disease. But with respect to COVID, make sure you're masking up and continuing to fight the fight.
That concludes our media availability for today. Thank you to APH Director Stephanie Hayden, Dr. Mark Escott, Epidemiologist Jana Pichette, and the poll reporter for joining us today. Thank you. Have a good morning.
And some say God is dead, but who's to blame? Falling out of what he thinks just has to be. What will he believe when we're tearing up? Cast into the light, as we are huddling, trying to keep warm when we're so bare, and knowing if we'd all just turn around, we'd all be there, unbecoming, falling out of what we think just has to be. What will he believe until we're shedding all the lies we've told before? Release your memory, and love will hear every word you say.
Take me here, don't run me down like this. I got miles before they're gonna lay me down, and I ain't ready yet, no, I ain't there yet. The Prelude highway hypnotizer, the lines across my face. One more sign before my mind begins to hallucinate and can't stay away. So give me something strong, let the night roll on today. Unsleeping night, so don't you fail me now. Crack the window wide and put your right foot down. So daydream through the night, but keep them wheels a spinning round and round. Unsleeping night, now don't you fail me now. Oh, there's a girl at home, she waiting up till dawn. Lord, she could use some sleep. I flash my brights and I dim my lights. I sink down a little deeper into my seat. Yeah, just to get back home, this old Rolling Stone gone 1,000 miles a night. To grant me speed and eyes to see my lonely girl tonight. She's so out of sight. Lord, don't make me sleep like a refugee, it ain't right. The unsleeping night, don't you fail me now. Crack a window wide and put your right foot down. So daydream through the night, but keep them wheels spinning round. Unsleeping night, say don't you fail me, say don't you fail me.